185 active cases across Victoria. I'm sad to have to notify all Victorians of 3 people who have passed away. A man in his 50s, a woman in her 70s, and a man in his 80s. We of course pass on our deepest condolences and our sympathies to their families and friends. This will be a very difficult time for them. Yesterday there were 71,275 test results received. That's a record by just a small number, a few dozen I believe. But I want to thank each and every one of those more than 71,000 Victorians who went and got tested. It's critical to us knowing where this virus is, where it isn't, contact tracing, trying to lock down those chains of transmission to keep people safe. So keeping those testing numbers as high as possible, so people acting on their symptoms, getting tested as soon as they register those symptoms, has never been more important. Even though case numbers are growing and it's not about 0 cases anymore, we still need to know where those cases are so that we can support you and we can protect you and we can limit the number of people that you potentially give this virus to. And we'll come to, in a moment, some very personal stories about what is at stake, what can be avoided, and what can be achieved if we all work together. 36,248 vaccines were administered yesterday in state hubs, plus of course thousands in GPs and community pharmacies. Just as getting tested is important if you've got symptoms, arguably there is nothing more important than booking an appointment, going and getting the first dose, then the second dose. It's safe, effective, it'll keep you out of hospital, it'll keep your loved ones out of hospital, and it's also our pathway to freedom and opening up. I'm very pleased to say that we now have 51.9% of the 16 plus population double dosed, 82.3% of the population 16 and above single dosed, and also we are now at 80.5% of the 12 plus group across our community have a single dose as well. So those 12, 13, 14 and 15 year olds have been very quick through the program as well. Can I just provide a reminder to those who are waiting for their second Pfizer dose, so people who've had a first dose of Pfizer and are waiting for the second dose, from tomorrow the interval changes down to 3 weeks. So please have a look online if that is relevant to you. If you are in that 3rd week, please go online, make one of the appointments. There are many appointments available, and essentially bring forward your second dose. That's now allowed, that's now appropriate, and it'll help us in that race to get to 70% double dosed, which is when of course the lockdown can come off. We think that's on or about the 26th of October, may even be a couple of days ahead of that, and every person who goes and gets that second dose sooner than they otherwise would because of these interval changes, that'll help us get just that little bit closer to being at 70% double dosed as fast as possible. Now, I also just wanted to remind people that it's not just state hubs. There's GP surgeries, there's community pharmacies, you've got AstraZeneca, Pfizer, and of course the Moderna vaccine available across those different settings. There are processes to go through. If you come to a state hub, for instance, and you've got an AstraZeneca appointment, you can speak to either a nurse, a pharmacist who's working for us, or indeed a doctor, and go through that informed consent process, pharmacy, and GP. So all 3 of us, those 3 groups are working very closely together. That's why we're seeing these numbers increase. It's not just about state hubs. So I thank our GPs and all those who support them, and of course we've had the opportunity to have both GPs and of course community pharmacists here on this stage talking about the work that they do. Today we're going to hear from some nurses who are nurse unit managers, and I'll speak about them in a moment, but they are on the front line. They are nursing and caring for COVID and non-COVID patients. They are dealing with incredible stress and strain. Every word that's spoken on this stage, every time we ask people to follow the rules, to get vaccinated, to get tested when they have symptoms, to stay at home, to not visit people in their homes, it's all about trying to make sure that our nurses don't have more patients than they otherwise would have, that an already very difficult job doesn't become impossible, that their hard work is valued, that they, as highly trained, highly skilled, highly committed professionals, are respected by all of us. We have to respect them and we have to respect their work. And the best way we can do that is to get vaccinated and follow the rules. And if we feel unwell, go and get tested as soon as we feel unwell. We're so close. We're so close. We can see to the other side of this now. But what will be freedom for the rest of us on or about the 26th of October, that is, the lockdown will be off and we'll march towards 80% and we'll have everything open. That'll be, for many, in many respects, the best time for our state, but it will be the hardest and most challenging time for our health system, the hardest and most challenging time for our nurses, our ambos, our doctors, the whole team. So I thought it was appropriate today to hear from them about what they're doing now, how they're preparing for what's going to be a very challenging few months, but also to hear some of the stories of what they're dealing with each and every day on the ward. To that end, there are 476 people that are currently in hospital with COVID-19. 98 of those are in intensive care. 57 of those are on a ventilator. Of all those people that were in hospital, around 500 yesterday, only 5% were fully vaccinated. In other words, if you are fully vaccinated, you are at but a fraction, a tiny percentage of the risk of being hospitalised and becoming gravely ill. Your risk is dramatically reduced. Dramatically reduced. It is the single most important thing you can do to make sure that you don't finish up in hospital or someone that you love finishes up in hospital. Because not only are you are less risk of getting it, less risk of spreading it, and if you do happen to get it and you're fully vaccinated, you are protected to a very, very high level. That's why getting vaccinated is so important. Now, to our two guests today, firstly, Michelle Spence is an ICU nurse unit manager at the Royal Melbourne Hospital, and Jackie Harper is a nurse unit manager at the Northern Hospital. They are highly skilled, highly trained nurses. They work with some of the most complex patients, and they are essentially in charge of their part of the hospital. They are senior clinical staff who have many years of experience, and what they tell me and what I'm sure they're about to tell you is that things are very tough, things are very difficult, and if you value them, if you value the work that they do, if you're impressed by them and thousands just like them, then let's all of us get vaccinated. Let's all of us respect them and respect the work that they do, honour the work that they do, and not make their job any harder than it already is. So let's all follow these rules for these next few weeks. Let's get to that 70% target. Let's get the place open, get the lockdown off, and then we will have to rely upon our health system. And it will stand up because it's filled with people who are incredibly committed. But none of us should do anything to make their job harder than it already is. I'm going to ask Michelle, first of all, to speak to some of the things that she's been experiencing, and then Jackie will follow her, and then Jerome will speak to the outbreak map, as it were, and then we're happy to take any and all questions that you have.
Thanks, Premier, and thanks, team, for the invitation today. As Premier said, I'm Michelle Spence, Royal Melbourne Hospital Nurse Unit Manager, and I've been in this role for about 13 years, but I've been an ICU nurse for about 24 years. I just want to provide some data to start with. Currently at Royal Melbourne Hospital, we have 135 patients with COVID-19. 19 of those are in ICU and 49 in our hospital and home. And as we speak, 8 are in ED waiting for beds. Since the end of July, we've had 90 patients at Royal Melbourne ICU. We're only one piece of the puzzle for ICU. I want to let you know, though, that not one of those 90 were fully vaccinated. Not one. And that's not just Royal Melbourne, that's every ICU that we're seeing. The data is very clear to us about what's going on here. The average age is about 60, but I've seen patients in their 20s and 30s. During that time, during this period from August onwards, not only have we seen 90, you might think 90 is actually not really that high a number, but as well as the 90 patients with COVID, we've seen 750 other patients, trauma, stroke, cancer services. Those patients do not go away. They absolutely need our care as well, and we need beds available for every patient. We often run at about 100% capacity, and we know the next few months are going to be really, really tough, and we are working hard to have beds available, but we can't do this alone. COVID does not discriminate. We've worked our bums off the last 18 months. It does not discriminate. Last week I saw a 30-year-old with no past history be put on a ventilator with not 150 kilos, just a you and I, put on a ventilator because he wasn't, in my opinion, he wasn't vaccinated. That was his card out of this. But he didn't get vaccinated and now is on life support at Royal Melbourne. It is not old people. It is not people with comorbidities. It is not anything like that. It is absolutely, it does not discriminate, and I've seen it with my own eyes. One of the saddest things I've seen over the last few weeks is people wanting the vaccination just before we put them on a life support machine. That is the absolute truth. I've seen it myself. They're begging for the vaccination. They're very young. And once we get to that and we're about to put them on life support, it is really too late. They can have the vaccination down the track, that can be an option, but right then in their healthcare journey, it is too late, and their families are remorseful. They're begging us to give them the vaccination. This could be you. If you're waiting now to get the vaccination, if you are waiting, it is your window not to be this person. It is your window to absolutely not be another unnecessary statistic. Over the last even 18 months, we have had people die in our ICU by themselves. Sorry, it's making me emotional. And we held their hands. We hold their hands while their families have to be at home. And that is absolutely not what this should be about. Loved ones deserve to have their families with them when they die. Not only are we busy with COVID, we're busy with stroke, cardiac, cancer services, and as I said, we need these beds available for everyone. So over the last few months, I've seen lots of things in the media about how can they not be prepared? How can they've had 18 months. We absolutely are prepared. We have all the equipment we need. We have all the PPE. Every day we're opening more beds. We are absolutely are thinking a step ahead. What else do we need to do? How do we do it? But they're not the things that are the risk. The risk is the workforce. And the Premier's pointed that out. It's going to be a tough few months for our workforce. We are banding together to get this job done, but we cannot do it alone. So right now we're working through a number of workforce strategies locally and statewide. We are training ICU nurses. That usually takes a long time. We're training them in 4 days. They're coming in. They've never been in an ICU before. Guess what? They're now an ICU nurse and they're standing side by side with us. They're putting up their hand to help. That's not just nursing, that's support staff, that's cleaners, that's doctors, that's paramedics. Everyone is coming out of the woodwork to make this happen for us as a community, for you as a community, and we need you to help us. Very proud of my team. There's nothing that they can't achieve. And very, very, very proud to be a nurse in a pandemic. Who would have thought? I signed up for this. But we've got this. We will stand shoulder to shoulder. We will get this job done, but we cannot do this alone. We are absolutely begging you to go out and do the one thing you can do for yourself, the one thing you can do for your family and your loved ones, and the one thing you can do for your healthcare system is to get vaccinated. Please do not wait. I know you're frustrated. I know you're scared. I know you're over it. We're all over it. But it's time. It's time to absolutely make a difference. I just want to thank every Victorian for what they've done over the last 18 months. You've gone above and beyond. You have supported us. You've fed us. You've watered us. It's going to be a tough few months ahead. And I really thank you for everything you've done. Let's get this done and sunnier days in 2022. Thank you very much.
Thanks, Michelle. I'm Jackie Harper, the Nurse Unit Manager on one of the wards at Northern Hospital in Epping. We have 3 dedicated wards for our ICU and ICU for our COVID patients. Today we have 70 patients in our COVID wards and 5 in our ICU department. COVID-19 is a terrible illness. The patients we see coming into our hospitals are seriously ill. The clinical deterioration is so sudden. 1 minute sitting in a chair, an hour later, they could be saying their goodbyes. They find it difficult to breathe, some needing high levels of oxygen, ventilators, and ICU support. Many regret not being vaccinated earlier. It is difficult for our patients unable to see their loved ones. We have to hold the iPads for them. But we need to keep our patients safe and our staff safe and you, the community. We are coping, but this is very challenging work. It is challenging and uncomfortable for our nurses. They wear N95 masks, face shields and plastic gowns every hour of the day. Each shift we are faced with numerous obstacles. also along with the pressure injuries we're all getting from those N95 masks. Our nurses, doctors, allied health and support staff are professional and dedicated, all working as a team around the clock. I'm extremely proud of them, their unwavering commitment to keeping our patients, each other and the community safe. COVID is real. It's affecting younger age groups and it's scary. It's really important for everyone to get fully vaccinated. All 3 of these vaccines are safe and effective and your best protection against this virus. It protects you from coming into a COVID ward or needing ICU. Please get vaccinated.
Thank you, Jackie. Thank you, Michelle. Nothing I'm going to say is going to make anything like as much impact as what Michelle and Jackie have just taken us through. I just want to take this opportunity to thank every single healthcare worker who's out there, who's doing the jobs that Jackie and Michelle are doing, who are standing with them, looking after very vulnerable and very sick people across our healthcare system, and who are looking at the weeks and months ahead with foreboding because of the workload that's coming their way. The hundreds of people coming their way with COVID, and particularly those cases that could have been preventable. In the last 24 hours, 47 Victorians came into hospital to be looked after. They're part of the 476 number that Jackie and Michelle have spoken to. All of us, those of us not working on the front line of the healthcare system, we're only being asked to do one thing: get vaccinated and stay home and comply with the directions. It's a pretty small price to pay, no matter how hard that is for all of us, compared to the workload that's facing those on the front line of our healthcare system. And the numbers are pretty stark: 1,220 cases, over half, 54%, under the age of 30. 70% of those cases in the last 24 hours under the age of 40. We are talking about young people, and largely unvaccinated young people. Our geography remains the same as the ones we've been talking about across our northern suburbs. We've seen almost 500 cases, 497 cases, in places like Epping, the base of the Northern Hospital. In our western suburbs, we have 361 cases, 30% of our total, in Truganina, Point Cook and Tarneet. Across the southeast, we're continuing to see a growth in cases, 236 cases now across Keysborough, Frankston and Pakenham. And in our eastern suburbs, we've seen 73 cases in the last 24 hours, now over 500 cases across our eastern suburbs. In regional Victoria, we have 52 cases in the last 24 hours across Mitchellshire. There's 9, 8 cases in Shepparton, 7 in Latrobe, 4 in Ararat around one of our meatworks operations, and 4 in Ballarat, and 5 in Geelong, and a few isolated cases elsewhere. Generally, the regional picture looks reasonably stable. We're continuing to work out those links and those clusters in the places we've been working through over the last few days. But we do have 425 cases in total now across regional Victoria. I mentioned briefly yesterday the cases in the Colac area. We now have 15 active cases in Colac. Still 300 test results to come back, particularly around the exposure site at the Australian Lamb Company. That site remains closed. My thanks to everybody in Colac, including Colac Community Health, for the fantastic work they're doing to support those with COVID, and of course to put that response together. We've seen a really big day and a huge turnout yesterday with over 71,000 people coming forward to get tested. My thanks to everybody who came forward and did that yesterday to allow us to get a good understanding of where the virus is currently lurking. 93% of our test results came back the next day, so I'm pleased to say our testing system is holding up to higher levels of demand than we've seen before. And over the last 2 weeks, we've added capacity to prepare for the high level of cases, with 26 new lanes coming onto our system to enable people to come through. We have set up additional testing facilities today at Bacchus Marsh to support, of course, the lockdown in the Moorabool area. That will open up today. Of course, we also have sites available in that Moorabool area around Daylesford, Gisborne, St Albans, Sunbury and Sunshine. And I'd please ask people in the Moorabool area, if you are symptomatic, if you need to get tested, please either go to the new Bacchus Marsh site or look at your nearest site to you, which may have shorter testing times. We're also continuing our work for GAT students, and can I just do a big call out? I know that many students, including one I have at home, they can't prepare for the GAT, but it'll be a landmark for them on Tuesday for those students in our priority LGAs, and we will have been in touch with your school and your school will have been in touch with you. So if your school has asked you to come and get tested, then please come forward and get that done. Over 3,200 students did so yesterday, and my thanks to them for interrupting their preparation for their VCEs and coming forward to get tested. But I'm sad to say that 3 positive cases were identified on the back of that additional testing. This is why we test. If you're a student who tests positive, you will receive a medical exemption from the GAT. Your results and all your hard work will of course be taken into account, but it's so important that we minimise the risk of positive students going back into our schools over the coming days, and particularly with the GAT. So again, if your school has encouraged or asked you to get tested, please do so. We have lots of testing capacity set up to do so, and today would be a good day to get that done if you've not done it already. Really, of course, all of our focus is on vaccinations, and again, as Jackie and Michelle have taken us through, it's the vaccinations the way out of this, and none of us wants to hear of stories of people who could have got vaccinated denying themselves that opportunity to avoid the consequences of contracting COVID. 80% of Victorians aged 12 and over have now had their first dose, and again, we've seen a phenomenal uptake with 11 to 15-year-olds, the youngest Victorians eligible to get vaccinated. Almost half have now had their first dose already. I'm also pleased to confirm that over 70% of the over 50s are now fully vaccinated. 1/3 of people, Victorians in their 30s, have already completed their vaccination journey, and then 1/4 of those between the ages of 18 and 30 are also fully vaccinated. What's even more remarkable is that we've seen a real significant uptake in some of those priority areas, and we've talked many times over the last few weeks around key LGAs such as Hume. I'm delighted to confirm that Hume is now 80% first dose vaccinated, compared to where they were only at the beginning of September when they were 40% first dose vaccinated, where they've doubled their vaccination rate. It's a testament to the phenomenal work of the community across Hume, the encouragement from local leaders, the local community, the council, also primary care networks, community pharmacy, GPs, and of course the state clinics and the various pop-up centres. It's been great to see people coming out and getting that vaccination done. Let's keep that momentum up. We have a number of other places we're working on. We're very keen to ensure that all these pop-ups and other opportunities to get vaccinated are taken up in the days ahead. Again, as we've talked to, the implications of not being vaccinated are quite stark in today's hospitalisation data. We've got 12 patients in hospital currently who are aged in their teens. None of those are fully vaccinated. We've got 22 patients in their 20s. Only one of them is fully vaccinated. We've got 64 patients in their 30s in hospital. Only one of them is fully vaccinated. And there are 60 patients in their 40s. None of them are fully vaccinated. This is really the data we need to see shifting literally over the days and weeks ahead. Now, with regard to some of our most vulnerable Victorians, I'm pleased to confirm that 71% of NDIS recipients, those on the National Disability Insurance Scheme, have received their first dose vaccine in Victoria. That's a pretty good result compared to the national data, but of course it's far short of the 82% first dose that we're seeing for all adult Victorians. And we're really keen to ensure that the most vulnerable Victorians, that are disabled residents and disabled citizens, are able to get access to vaccine and then follow that up. There are dedicated disability liaison teams set up within the department that will help you get your vaccination done. So if you care for somebody with a disability, if you are someone with a disability, if you need some support and help, please go to our website or contact your normal service provider, and they will help you, put you in contact with our vaccination teams, and to help you get safe and easy access to vaccine. We're really keen to make sure we look out for everybody and make sure we get them vaccinated as soon as possible. There are now, as I said yesterday, thousands of first dose appointments available across the state clinics, and of course our GPs and our community pharmacies now have access to more vaccine than ever before. So please use all those opportunities to get vaccinated. From tomorrow, there'll be 10 additional vaccination sites set up and running, with over 100,000 doses of Moderna vaccine available over the coming week through those 10 pop-up sites. I'm pleased to confirm that over 50,000 Victorians have already had a first dose Moderna, either through community pharmacy or one of our state clinics, and we're really keen to ensure that so many other people continue to get their first dose of Moderna over the next few days. Again, it's a great opportunity to really get this done as quickly as possible. One of those sites will include the Dandenong Palm Plaza, where we've been vaccinating quite hard over the last week or so. And there's a group of community and faith leaders that will be there today from the local area talking about the importance of vaccination in the South East community and the importance of getting people good access to vaccine. It is being set up as a media opportunity. I hope many of you here today will hotfoot it to Dandenong this afternoon, and please do give that coverage. It's so important that we recognise the efforts being made in local communities to get vaccination done. That's where the leadership is coming from, that's where the passion's coming from, and that's where we need to give people the safety, the trust and the confidence to complete their vaccination work. Finally, I just want to do a quick thanks to the Melbourne Museum and the Royal Exhibition Building. Pleased to confirm that the restoration works in the exhibition building have been completed, and from tomorrow you'll be able to get your vaccines again under the famous dome. So we will be relocating our vaccination centre from the museum to the exhibition building, and that will of course continue to be a flagship for us of the state's vaccination programme, and almost a symbol, I think, of as we head towards 80% double dose, hopefully in the coming weeks. We've already delivered over 40,000 doses at the museum, but we will of course now go forward with St Vinny's to complete that work at the exhibition building. With that, I'll hand back to the Premier for questions.
Thanks very much, Jerome. I'm happy to take any questions you have.
Can we hear from Jackie, if that's okay?
Sorry, Samaya?
Sorry, can we hear from Jackie?
Absolutely.
if
Why
that's
don't we? They have given up a very precious thing, a day off, or a large part of it, to be here. So I'm more than happy if they go first, and then they can perhaps go, and then you can deal with whatever other issues you want to ask me about.
Thank you, Jackie. You've obviously painted a very grim picture, I guess, about what's happening at the northern, it's the epicentre of the virus outbreak at the moment. We've heard of ambulance ramping, staff shortages. Can you maybe walk us through what it's like, what it has been like to be a nurse right now?
To be a nurse right now, very challenging when the community are not getting vaccinated. We've got to do all those other things. We've got to do the orthopaedic traumas that come through, all of the other cases we get as well. Yes, we had a record day on Monday with the ambulances ramped, but we're planning for another ward if need be, and being in that epicentre, it's been hard. Many nurses don't know that this is what they want to do anymore. But we will get through, as Michelle said earlier, we will get through. We will do it for our community.
And how has how has the system been able to cope? And do you have any fears that it might not be able to cope for very long, just given, I guess, the workforce issues around burnout, fatigue?
There's always going to be that challenge that we might not cope, because COVID's unpredictable. We don't know what patient's going to decline in the next minute. So we might not cope, and we all have emotions too. So dealing with the challenges of people not being able to see their loved ones, us holding their hands for that last dying breath, it's hard. So yeah, we might challenge to cope, but we will cope. That's what nurses do.
If you do struggle to, what does that look like from a patient perspective? Where do things fall off for them?
Our patients are our first priority. We will look at different strategies. We've got our students coming back into the workforce, back onto the COVID wards to help us. So we will look at different models of care to make sure that we get through this, and our patients are always our first priority.
We hear a lot about living with COVID, opening up, freedoms, protests, vaccination mandates. How does all of this actually make you feel, just watching it all unfold?
Frustrated, very frustrated. I know from my team, they're frustrated at the protests, those that not wanting to get vaccinated. But if we all work together, we can get this done and beat COVID. It's been a long time, but we will get it done.
Have you come across distinct anti-vaxxers who are either patients or families or relatives of patients who've had their minds changed by what they've seen?
Many have had their minds changed from what they see. Unfortunately, at that last minute, you can't get vaccinated. we need to treat you first, and then you need to get better before you can have that vaccination. But yes, families have had their minds changed. It's more important everyone just get vaccinated.
Thanks.
All good? Just before we came from my office across to here, Michelle was telling me about a patient that she was nursing very recently. That person's on life support and we wish them well. They're 30 years old. They were asking for the vaccine, begging for the vaccine indeed, just moments before the tube was put in so that the machine could help them to breathe. It's too late when it gets to that point. You've got to go and book an appointment today, and there are appointments available. For yourself, for the people that you love, for the people that love you, for people you will never meet, for heroes like these two individuals that have been with us today, and thousands, tens of thousands more. If you respect our nurses, if you value them and the work that they do, then let's none of us make their job any harder. Let's instead get vaccinated. Any other issues? There seems to be a silence that's come across you all. We should just walk off the no. Yeah, I'm sure there are other issues you'd like to talk to me about.
Michelle flagged that they're already basically running at 100% capacity. Jackie has said something similar. I know we're seeing a stockpile of ventilators today.
Yep.
How does that play into this?
We'll open beds as we need to. So because ICU beds are so precious, and because you don't have unlimited numbers of staff, we don't open ICU beds and then have them empty with a nurse at the foot of the bed waiting for a patient. There'll always be slightly more than what we need on that at that given moment, but we open beds progressively, and we'll continue opening them. But you know, we are hoping, and we're all working as hard as we can to have less patients, not more. We know there will be more though. It's just a question of how many. And the biggest limiting factor is not machines, it's not tubes, it's not gowns and gloves and shields. It's people. And we don't have an unlimited supply of nurses and other dedicated health staff. And the fact is that the last 18 months have been very, very difficult. Very difficult, COVID and non-COVID. So there's not many fresh legs as we enter this final quarter. People are tired.
So realistically, how many ICU beds could we open at a maximum capacity for staff and equipment?
We've provided you with details around different phases around hospital admissions. And it's not just ICU, that's the other point. Like, I see a lot of commentary about ICU. You've heard from two nurse unit managers today, one that runs an ICU and one that runs a general ward, and it's just as challenging. It's just as challenging. COVID patients are challenging no matter what stage of illness they're at, because it's a wildly infectious virus. We'll open as many beds as we can possibly open. We'll open as many beds as we need. But that's not what success looks like. You know, thousands and thousands of people on a machine to breathe is not the desired outcome. I'm not in the business of recruiting people into ICU beds or into hospital, into grave illness. That's not what a good outcome looks like. The far better outcome is, of course, we'll provide the care for those who need it, but that number will be lower, we hope, than it would otherwise be, because people will be prompted, not just by what I say, but what people who are on the ward, on the front line, literally holding the hand of people who are dying, people will act on that and they will go and get vaccinated.
Sorry, apologies. Just on that, can we hear from Michelle just around
Absolutely, you
ICU
can.
and ICU capacity?
Sure. I was kind of leading you there, but anyway.
Thank you. So just on the questions, we are opening more ICU beds on Monday at Royal Melbourne. There is ICU beds being opened around the state. That is a staged approach, as the Premier said. It's a staged approach on the need and with the current forecasts. How are we doing that? We are training, for example, at Royal Melbourne, we're training peri-op nurses. So we've got peri-op nurses in the last 2 weeks who have been trained up to care for ICU patients. And as Jackie said, there'll be different models of care, and we're looking at those models of care. So each week we're looking at what is the next stage. So when, as the Premier said, we're not going to open 100 ICU beds tomorrow, but that commentary and that planning continues to happen.
So We've been hearing a lot about 4,000 ICU beds, or thousands of ICU beds.
Yep.
Is that commentary a bit redundant now that we're at this stage of the pandemic, essentially?
Yeah, look, I think that that's always been the plan. That is the plan in the bigger picture. I suppose we've got to a point now where we're looking at what workforce we have and how we do that. And we will do that in stages to get the job done, absolutely. So the workforce is that constant training, but as you can understand, we're pulling workforce from other areas. We've got lots of ICU nurses in vaccination hubs. We're looking how we can pull them back into the workforce. And this is this constant commentary. We're working really close as a state together to make this plan happen. Can I tell you a number? I'm not going to stand here and tell you a number, but can I tell you there's a stage plan? Absolutely, and we'll continue to work through that stage plan. But get vaccinated now, we won't need 4,000 ICU beds. That is, get vaccinated today. That is the absolutely, and don't be one of those numbers. No one wants to see me at the end of their bed.
What's it like being, it's a question that I asked Jackie as well, what's it like being an ICU nurse or an ICU unit manager over the past 18 to 20 months?
It's such a proud team. They're so proud for the work they do. It has been a really interesting 18 months. Last year there was adrenaline. We can do this. Look at us. We're preparing for war. This year people are tired, just like the community's tired. They're frustrated. They're tired, but they signed up for this. They want to do the best for their people. They want to do the best for their community. Full PPE, 12 hours, pressure injuries on their face. Not ideal, not really what we signed up for, but we do it because that could be one of our loved ones. That's why we became healthcare workers. We do it because we care, and it is absolutely in our mantra. It's our being, and we'll continue to do it. There is tough days. I'm not going to lie to you. People are worried about the next few months. We talked about when it opens in October, that will be great for all of the community, but it will be our toughest time. We're feeling like between now and Christmas, it will be our toughest time. But we just want the community to work with us, do the right thing, get vaccinated. We see people doing that. That gives us the adrenaline to keep on going.
Michelle, I know it's really hard given that it's a moving feast, but you mentioned the ICU nurses who are helping out with vaccination at the moment. Are you confident that the staff is being used as efficiently as possible right now?
Absolutely. So, we had a lull in ICU before this wave. We had our normal, but we were able to release nurses to vaccination because that was the priority at the time. Vaccination, testing, absolutely. Now we're working with those partners, bringing, junior nurses into vaccination to bring those ICU nurses back. And this is this commentary that's constantly happening. We're even working nationally with other ICUs about whether we can utilise their staff in Queensland, etc. My head is spun around as a workforce strategic plan. There's things that are coming out of the woodwork that we would never have done before, but there is a need to do it. This is hopefully a once in a lifetime pandemic that as a manager I'm not going to have to do it again, but we will do whatever it takes to get the staff there.
So using staff from interstate?
That's something on the cards. We haven't got there yet, but this is the workforce teams that we're working with to think about, is that something we could do down the track? Is it something that we could bring nurses from Queensland to help out? And again, don't hold me to that, but nothing is off the table here, because at the end of the day, we want every patient who needs a bed to have a nurse to look after them, and other workforce, anaesthetists, etc.
In terms of ICU, obviously, by the name, patients require quite intensive care.
Yeah.
Is there a chance that as this outbreak grows that the patient-nurse ratio will have to change?
Look, at the moment, that's a good question, and it's always brought up. At the moment, that's not our plan. Our plan is to do models of care where more junior staff would care for a patient and an experienced ICU next door, or in a group, using pharmacists, using allied health to do turning. We're already doing that at Royal Melbourne. The allied health team are helping to prone our patients so that we don't use nurses to do those roles. We are absolutely thinking outside the box. But at the end of the day, we want every Victorian to get the care that they require, and we will absolutely continue to do that. So we're not changing models of care at the moment. We're looking at all the workforce strategies first.
And you mentioned that you've cared for really young patients, including someone in their 30s. Can you maybe walk us through that and explain?
I've seen fit, 70 kilo. I say that because people think that COVID people have to be obese. No past history, no medical history, tradie in his 30s is someone coming to mind, and who is the only thing I can tell you that would have changed, and again, this is my opinion, I've seen it at the end of the bed, is the fact that he was not vaccinated. Not vaccinated. His family weren't vaccinated. So here is an opportunity for that patient to have never met us, to have never been in an ICU bed for 2 weeks, without his family, without his loved ones, because he could have got the vaccine. That is it. There is no, I've got no hidden agenda here. I've got no political stance. At the end of the day, that is what I'm seeing with my own eyes. And the sad thing is, we're going to continue to see that if people aren't vaccinated. There is an absolute way out of this. And it makes me so sad that there's a missed opportunity for really young, particularly that 20 to 50-year-olds. We've seen that data. That 20 to 50-year-old, there is an opportunity for them to never be a number and never be in hospital and never put their families at risk.
Michelle, when I spoke to one of your colleagues, Dr. Stephen Tong, he mentioned that younger Victorians who are ending up on ventilators are having a better chance of coming off them. Are you seeing that in your experience?
Yeah, the Delta strain's very different to COVID last year. I mean, COVID last year, we had our average length of stay in Royal Melbourne ICU was about 72 hours. Last year, patients were staying 4 or 5 weeks. It was a really long haul. There is no doubt that the Delta virus, once they're on a ventilator, the younger ones do recover more quickly. They are still with us though for 1, 2, 3 weeks. And once you're on a ventilator, there is other risks, there is other risks that can happen once you're on a ventilator. So we definitely are seeing patterns with healthcare in ICU. We're definitely seeing things we're doing like proning that is definitely making a significant difference, where we turn our patients onto their stomach so it gives better expansion of their lungs. That is absolutely making a significant difference. But you don't want to be in ICU for 2 to 3 weeks. You are going to have long-term issues. That is, yes, you'll get out of ICU, but that doesn't mean your healthcare journey has ended. So while they're recovering and their ICU stay might not be as long, there is a long, long haul. And these are for young people that should never really have to come in the front door.
What have you seen in regards to people who might be suffering from long COVID who have, symptoms down the line?
Yeah, look. Obviously, we haven't seen long COVID with this wave, but we have seen long COVID pre-Delta. People have long roads ahead of them. Young people have significant cardiac issues, fatigue, and there is no doubt that I've talked to a few people in long COVID clinics. And that's the thing I think people think, oh, well, I might go to ICU, whatever. This is years of rehabilitation. This is years of your family, you're relying on your family for your healthcare concerns. So there is no doubt the group that we're seeing now will have issues ongoing. No doubt about it.
And there are some Victorians in hospital who are partially or fully vaccinated. Have you seen a difference in regards to their recovery versus unvaccinated people?
I haven't personally. I know out of those 90 patients I've talked about since August, only 7% had the first vaccination. We'll obviously see that data down the track about what their recovery is like, but at the moment, all I can see is unvaccinated. That's what I'm seeing.
When you say we haven't seen long COVID with this wave, is that a feature of the Delta variant, or is that just we don't have the data because we're in the middle of it?
Yeah, I don't think we have the data and the time yet. Look, there's obviously other professionals who would be in clinics would have that information, but not from an ICU end at the moment.
Thank you.
Thank you.
Okay, other issues?
The 3 students who tested positive that
Yes.
Jerome had mentioned, are they from the north or the west, or which suburbs are they from?
I don't think we'd indicate what suburbs they're from, just for privacy's sake, because there's only such a small number. But it just validates why the testing's important.
And is there a potential for, obviously we're seeing, still growing cases in Melbourne's north to a degree, the west to a degree, also to the southeast, a potential for students not to return this week or in staggered returns over the next couple of weeks?
No, I'm not here to announce any changes to the education roadmap, the school's roadmap that the Deputy Premier's outlined. So we're all very keen to get the GAT done and then deliver on each of those. Well, it is already a staggered and staged reopening. Not every student every day. That's not going to happen for a while. So the plan is still in place, and I've got no advice to change it.
We equalled the world record for the longest lockdown today with Buenos Aires. Can I just invite you to reflect on that?
I would simply say how proud I am of every single Victorian for giving so much, for working so hard to save lives, to get through this. We achieved an enormous amount last year. We didn't choose for this Delta strain to come to us from Sydney. It did. It's taken hold. It's wildly infectious. We've got to stick together. And what is deeply impressive and makes you very, very proud is that Victorians are not only tough, but Victorians have great compassion. So many acts of kindness. So many occasions when people are looking out for each other, supporting each other to get through this incredibly difficult time. I'm grateful, I'm proud, I'm impressed, and I, like the rest of Victoria, I can see to the other side of this now. It's only a few more weeks. We've just got to get vaccinated, get tested if you feel unwell, but get vaccinated, get vaccinated, get vaccinated. That is the key. Not just to meet our targets, but to have less people in hospital. They are my reflections. It's been bloody tough, we know that. But the Victorian community have been so impressive in the way they've looked out for each other and in all that they have endured and overcome. It is impressive. It makes you very, very proud.
The opposition says 245 days is not an indication of success in managing this pandemic. Is there anything you believe you could have done better?
They are utterly irrelevant to the work that I'm doing, and politics doesn't work. This is a pandemic. So political games and words from people who have no responsibility whatsoever, unburdened as they are, I'm not going to be responding to that.
Well, then I'll take you then to Sydney. They only had, New South Wales only had 667 cases today. They handled their lockdown a little bit differently with more targeted and tougher rules in those hotspot LGAs. Do you think we could have done the same thing?
No, because I didn't have advice to do that. And actually, as I've said, Mark, a few times now, and I'll say it again for your benefit and everyone's benefit, former Premier Gladys Berejiklian would routinely, at National Cabinet, try and convince me that her lockdown was the hardest lockdown anywhere, and that, ours, and the next week we'd be having a debate about whether ours was harder than theirs. Look, you follow advice. You do what the experts tell you to do. We wouldn't be standing up here reporting 1,300 cases today if we were open, and these guys would have a fight they couldn't possibly win because they'd have thousands and thousands of patients, not hundreds. We have followed the science, we have followed the data. We've been praised by some, criticised by others, supported by some. Others have decided to play silly games every day of this pandemic. People can make their own judgments. This is an incredibly difficult time for our state, but because we've looked out for each other, because we've pulled together, because we have been able to do amazing things as a community, we can look with a sense of hope and optimism to these next few weeks and indeed beyond that. Games have not got us here. Politics has not got us here. Only a steely determination and the courage and the character and, can I say, the compassion of the Victorian community, looking out for each other. That's what's got us to this point now, where we're only just a few weeks away from being able to get this lockdown off. In the meantime, rather than reflecting on the past and playing silly political games, let's all get vaccinated. That's the most important thing. 1 dose, then 2, and you won't have to make the work of these health heroes any harder than it already is.
You've mentioned the 50% double dose target a number of times in terms of curbing this spread. We're there now.
We are.
Have you been given any advice? I know it's hard off 4
Yeah,
days
it is.
data,
It is.
but are we going to downturn like New South Wales?
Well, we've got modelling. That modelling says we haven't reached the peak yet. The point I've made a few times, and I think they've made this point in New South Wales as well, the data supports this contention that once you get to 50% double dose, you do start to see things change. And that doesn't mean that the cases plummet, but you can have, and we would hope to have some stability come to these numbers. But again, it really is in the hands of every single Victorian. If you get vaccinated, you're at far less risk of getting this. If you follow the rules, you're at far less risk of getting it and spreading it. If you're not visiting people in their homes, then you're at far less risk of driving those numbers up. So that's just logic. And I know it's incredibly difficult. I know it's tough. No one is enjoying this, but we are so close to the end. We've just got to finish this off. We've just got to finish this off so we can get the lockdown off at the end of October, get the place open, and look forward to not just 2022, but many weeks before Christmas, and Christmas being the sort of Christmas that we want. And I want everyone to be there. I don't want them to be in hospital. I want them to be with the people that they love. I want people who have been locked out of their state to be able to come home, and people that have been locked into their homes able to move around freely. That's what we want. That's what we can have. That's what we can deliver. But we've just got to see this thing through.
Have we been able to determine how, the government or authorised officers will essentially be able to enforce mandatory vaccination in businesses, like hospitality patrons, for example? Is there a framework around that?
There are. Are you talking about patrons or workers, Simone? Patrons. Oh, there'll be some further announcements. It'll be a technology-based thing where the act of QR coding in will also determine whether you are vaccinated. And again, it'll be different for different venues. So some venues, for instance, where you have to pre-book then you'll be clearly informed, and I think most people will know anyway, that in order to fill that booking, in order to take your seat at the table that you've reserved, you'll need to go through a check-in process. Other environments where it's more kind of walk up, that'll be more focused on that particular moment. But look, this is not on any one business. These are not rules that a business is putting on. These are rules that the Public Health Act and the National Plan speaks to. Having a go at a business owner, for instance, for insisting on certain things, that wouldn't make any sense, because they're only doing their job. They're only fulfilling an important requirement to try and keep us all safe. As to the mechanics of that, I think that we'll be informed by the trials that we've announced. They're happening very, very soon. And there'll be probably waves of trials, not just they're in regional Victoria now, they'll be in metropolitan Melbourne. It's obviously easier to do those trials once we're open, once the lockdown's off. But I think there will be a time for us to have probably a lengthy discussion about that, and Minister Pearce and Minister Pakula will be back to talk about the results of those trials.
And under the Burnett's modelling, they had an assumption that parents of childcare workers would need to be vaccinated. Is that still something you're working towards?
We made mandatory vax announcements the other day that cover all authorised workers. Beyond that, there will be other cohorts that will be the subject of specific mandates. They're not necessarily... there already are people who are covered. Their dates didn't change. The new dates came in for the balance of people who are authorised workers. There are some people who in the future will probably have to get vaccinated. They're not an authorised worker now, but they will be once we open up. And there'll be judgments made by the Chief Health Officer against the whole detailed framework, all the things that he has to consider, the proportionality, the risk, all of those things, so that they're done in a legally appropriate way. The decisions that were announced on Friday are very much the result of case numbers growing too fast and us having a really significant threat to the capacity of our health system. So there'll be further announcements made, and they'll be the subject of further work that the Chief Health Officer and his team do.
How do you enforce mandatory vaccination on MPs, for example, or even on judges?
Well, I just make the point, whether you're a judge of the Supreme Court or a member of the Victorian Parliament, the virus doesn't care what you do for a living. Like, you're just as likely, unless you're vaccinated, to get it and spread it. And it doesn't matter what you do for a living, everyone's covered, whether you're a judge or not, everyone's covered by the Public Health and Wellbeing Act. So, we all of us need to play our part. And the best thing to do is to get vaccinated so that you're not risking your own health and, of course, the health of the people that you love. And more broadly, making the work of our nurses even harder. Any title you may or may not have is completely irrelevant when it comes to the spreading of this virus.
What about a 20-time Grand Slam winning tennis player?
Those titles won't protect you either. The only title that'll protect you is that you can be able to say that you had your first dose and you've had your second dose.
Is that to say that mandatory vaccination for all Australian Open tennis players will be a thing?
Well, I'll put it to you this way. The only people I reckon, again, the federal government are the people to talk to here, because they're the ones that control the borders. I've got enough to get on with. I don't do visas and passports and things like that, right? But logic tells me, and numerous conversations with the Prime Minister over a lengthy period of time tells me, that if you're an Australian citizen, you will be allowed home if you haven't had the jab. But if you're coming on a tourist visa or a business visa, so you're not an Aussie, like you're coming to visit, the notion of you getting in here without being vaccinated, I think, is very, very low. But again, the Commonwealth Government are the ones to make that clear for you. But, I think it'd be unlikely, in my judgment, it's not my decision, but in my judgment, it would be unlikely that you would get a visa. So perhaps the feds are the people to talk to there.
If they do, though, if the Commonwealth does, will we at a state level mandate vaccines for professional sports players?
We already have. If you are an authorised worker, then you need to have your first dose by the 15th of October. And that'll apply to, if you're an AFL footballer who wants to start pre-season training in just a few weeks' time, you will need to be double dose in order to be an authorised worker. Now, we won't have an authorised worker list come Australian Open tennis. Or at least that is my profound hope. that we've well and truly exceeded 80% double dose. Nothing's closed then. We're open. We're back to something normal. We have normalised this. We've passed through that very difficult gateway. But getting into the country, I think that if you're not an Australian resident, not an Australian citizen, then I think that your vaccination status will be something that the federal government is very much focused on.
When do you imagine that authorised worker list will drop off?
Oh, well, once the lockdown is off at 70%, we no longer have a limited number of reasons to leave your home, one of which is that you're an authorised worker. So we
Does that
will...
mean the vaccine mandate also drops off then?
No, no. As we were very clear on Friday, the vaccine mandate, and that's why the date for the second dose is actually at the end of November, not the end of October. So that's why this applies to everybody who's an authorised worker now, and it'll apply to them even when authorised work is not a thing, because they're the ones that are moving around now. And we may add to that list as different industries open up, as different groups of people are moving around the community. Every vaccinated person is, the statistics are very clear, pretty well one less person that's going to finish up in hospital, and one less person that contributes to somebody else finishing up in hospital, because you are at a significantly reduced likelihood of getting it. And if you haven't got it, then you're not going to give it to anyone, are you? So for every reason, for those you love, for those you've never met, for freedom, for normality, and as the most powerful way that you can honour and revere the work that our nurses do, get vaccinated. Book an appointment today. There are thousands of them available.
So if I'm an authorised worker that's determined not to get the jab, I have to just hang out, not work until around the Australian Open or thereabouts, and I can come back to work.
No, that's not what I'm saying at all. That's not what I'm saying at all. I don't know. I'm sorry if I've not been clear. Mandatory vaccination will be here well beyond the notion of authorised work. Authorised work happens now because there's only a certain number of people who are allowed to go to work. Getting vaccinated in order to keep going to work is not too much to ask. I'm sure there are a lot of people at home who can't go to work and would dearly love to, that would be scratching their heads at the notion of people being resistant to that. But what I'd say is that the vast majority of people will go and get vaccinated. They already are. You know, we had some protests the other week, and I made it clear at the time that they didn't speak for tradies. Some of them were trying to dress like tradies, but they didn't speak for people in the building and construction industry. In fact, it was an insult to the vast majority of people from that industry who are not wreckers, they're builders. Hard-working, decent people. I've met many thousands of them. Our government's employed many hundreds of thousands of them over the last few years. Our vaccination hubs, and I've got no reason to believe that pharmacies and GP clinics wouldn't be the same, have in recent weeks been a sea of fluoro, as people in the building industry have flocked to get their first dose and their second dose so they can come back to work. Good news is they're going to be back open, with rules of course, but back open on Tuesday.
What do you make of the $1 million vaccination campaign?
Yeah, look, it's great. I think anything we can do to encourage people. I'm not so fussed at what motivates you, whether it's for your health, the health of the people that you love, to protect our health system and value the work of our nurses, or to win $1 million. I'm not fussed. Just go and get vaccinated. That's what I'm asking, because it's our way out of this. It's our only way out of this.
Can we ask Jerome a question?
Of course you can. Any more for me?
Can I ask, the opposition is again calling for the curfew to be scrapped now that it's daylight savings, and they're saying that there's no health advice to back the curfew. What's your response?
It's simply wrong. And I've again made the point many times that case numbers are limited because of a range of different things. And all of those different rules work as a package. And I provide my profound apology to people if they can't do their grocery shopping at 1 o'clock in the morning, or if they can't do their exercise at midnight. I apologise. If that is a thing for you, I absolutely apologise. But my advice is that the curfew plays a part as part of a broader suite of rules. You will recall last year it was 8 o'clock and then we moved it to 9 o'clock when daylight savings came. It's always been at 9 o'clock this time round. It will come off, as the roadmap indicates, once we hit 70% double dose. And at this rate, and of course it's in our own hands if we go and get vaccinated faster than we otherwise would, we'll get there even sooner. But it's going to be, it looks like, the 26th and maybe even a couple of days before then. That's how you get the curfew off. That's how we get all the lockdowns off. That's how we have the community open. and then we steadily open businesses, schools. We move through that gateway, as difficult as it will be, but we get to the point where we're living with this and it's normalised. That's what we're all after.
When do you think we'll see our first booster shots, and when do you think we'll see our first booster
Yeah,
shots?
sure.
Which population?
Sorry, I heard. It is for the federal government to make announcements in relation to boosters. I've asked similar questions. All of us have, I think, at National Cabinet, and we are assured that the appropriate stocks have been ordered. But who gets it, how it's rolled out, all of those things, they really are matters for the federal government. There was some discussion about this at National Cabinet on Friday, but the announcements as to whether it's population-wide, who's going to be administering them, the time frames and all of that, that's appropriately a matter for the feds.
Despite Victoria recording a record number of days in lockdown now, we also sadly have had the highest number of deaths in Australia. Obviously it's a virus, it's largely out of your control. But I guess how much responsibility do you take for how long we have been in lockdown?
Well, I'm the leader of the state, and I show up every day, working every day, every night, doing the very best I can, doing as much as I can, leading a team that I'm proud to lead. And it's not just politicians, it's not just senior public servants, it's also nurses and ambos and doctors and cooks and cleaners and orderlies and everyone across the community who's been working in our pandemic response. They're all doing their best, and I'm proud of them. And I'm proud of Victorians too, who've given so much. There is pain, there is loss, there is, however, hope and a real optimism and a clarity. We are going to get past this. We're going to end this lockdown and open up. And all that we will enjoy then will be the point. The alternative is every death is a tragedy. The alternative is not the numbers that you are referring to, but a much greater number, a much, much greater number. And these are the kind of questions that are never posed back to those who are, well, people are free to be critical, that's fine. But okay, if you're unhappy, what's your alternative? What would you do? Would you open everything up tomorrow? Would you pretend that it was over because you desperately wanted it to be? It isn't over yet. It will be soon. People can be optimistic and positive. I am that and more. I am proud and I am grateful for all that the Victorian community has done. No one in this country has stood up the way the Victorian community has, because we've had to deal with more. That's the nature of these things. Not only am I proud, but I'm grateful. And I'm inspired to keep doing the work that I do. All of us are. But the key point here is that it's not just the people behind the podium or the people at the end of the bed in ICU. It's on all of us to go and get vaccinated and play our part. That's the best way you say thank you to these heroes, and it's the best way that we get free. If there's no more for me, there was a question for Jerome. He's eagerly waiting.
What the ref number in Victoria is at the moment, and are you noticing a steep decline in those northern and western suburbs?
So the ref number I'll leave for the Chief Health Officer to speak to in the coming days. I don't have that in front of me, as you know. I'm not a clinician. In terms of that, we're seeing a spreading out of the virus rather than a steep decline. I think we've seen a somewhat encouraging trend in the western suburbs, and we've seen that over the last couple of weeks where the rate of growth has been pretty modest. If you look at it at an LGA level, we're seeing some LGAs really quite, like Hobson's Bay with a high vaccination rate, Wyndham with a high vaccination rate. We're seeing really quite low levels of case growth on the whole. We've seen other LGAs we've had more concern. Hume continues to drive quite hard at its overall case numbers. We'll watch Hume very closely over the next few days, and particularly as the vaccination rate starts to go up. But I think the area of concern around the outbreak is, over the last 4 days, since the numbers really stood up 4 days ago, over those last 4 days, we've generated half of the total active cases we're dealing with today. So, well over 5,000 cases. We've got 11,500 active cases in the States, almost half in those last 4 days. So that's a really significant, not only step up in the number of cases we're generating, but also where it's happening. And with the number of cases we're seeing in the southeast, and that's been relatively lightly touched in this outbreak so far, we're very concerned about that. That's why there's all those pop-ups, that's all that activity, focus down there is so important. But also regional Victoria with, over 400 active cases, that's a real area of concern.
By the time your concerns in the southeast grew, they obviously have much higher vaccination rates compared to where Hume and the western suburbs had started. does that sort of placate some of your concerns, I guess?
No, look, I think it's my job to be concerned, right? It's my job to be worried about where the cases are and what those dynamics are around. So we'll keep being very anxious in all those locations. Clearly, what we're looking for in the weeks ahead is, are we seeing that drag effect of higher first dose, second dose vaccination levels that are starting to slow down the spread? But it's two things. It's, as the Premier said, it's about get vaccinated, but it's also about you've got to hold on to these behaviours for these last few weeks. That's what stops the spreads. You know, we saw the cause and effect from a week ago. The long weekend, the grand final holiday weekend, how that suddenly led to that spike that none of us wanted to see over the last 4 days. The numbers we see over the next week will be based on the behaviours that we've all been part of over the last few days. So we'll see how that plays out.
And the transmission in the southeast, is that predominantly, is that because of, you know, I'm sure there are a lot of factors
Sure.
at play, but household transmission, authorised worker, essential worker, can you maybe walk us through, I guess, the dynamic of
Yeah,
the
so
outbreak?
what we're seeing in the southeast is we're seeing in other parts of Melbourne, we're seeing obviously a really high attack rate within households. So when COVID gets into your household, then we're seeing a lot of other members of that household also contracting COVID in the subsequent days. That's driving a big part of the growth numbers. Secondly, we're still seeing that household to household transmission with people who are visiting each other in their homes for those ad hoc things, often through related family groups and close friendship groups. All understood, but really unhelpful, because that's what's been driving these numbers for most of the last 2 months. And then is that final piece, that increased step up that we've seen over that last holiday weekend of the social gatherings of various types. We're seeing a fair spread of that, because that's what that's done, is it's taken it from a tight number of postcodes to a broader set of locations, and that's what's really concerning. So wherever you are in the southeast, wherever you are in Melbourne, there are now cases near you. So you can no longer kind of assume, oh, this is a Hume problem, I don't live in Hume, therefore I'm okay. That no longer applies. The upside, one of the silver linings is that, again, workplaces have been pretty tight. So we've not seen significant transmission at workplaces. That's why I talked about COLAC, where we're seeing pretty one major workplace where we're seeing a bit of transmission. But again, the really important role that businesses got, for those essential businesses, the tighter you can keep your COVID safe principles, encourage your staff to get vaccinated, make sure they've got it done, because we do not want to see workplaces become super spreader sites.
Jerome, just back on those
Mark.
active cases, even though we've seen thousands in the last couple of days,
Yep.
our active caseload's only gone up by like 194 today. So
Sure.
where's the extra 1,000 going? Are they just older cases?
Yeah, it's so obviously what we're seeing, Mark, is older cases do start to come off the books. So, we've as we talked about yesterday, we're spending a lot of time ensuring that active cases have a swift and effective end to their quarantine period, so they come off those numbers. So you'll absolutely see numbers go up. Our numbers, our overall active cases will continue to rise, while our numbers are above the average that we've seen over the last couple of weeks. As soon as that starts to plateau off, the numbers will start to
I
stabilise.
suppose the question is, why is it such a large number that are coming off all in one go, even the last couple of days? I think we went down in terms of active cases 3 days ago. Is there a backlog in terms of contact tracers checking in on those active cases, or day 13 tests? Why is such a large number all coming off at once?
Yeah, I'll check that back with you, Mark, in terms of what those numbers look like in the show release. But we've had a reasonably consistent performance around releasing people from their quarantine at day 14. So again, if we have sped up those processes in the last few days around making it easier and that process simpler about exiting your quarantine. What we're also, of course, dealing with is significant numbers of households with large numbers of cases in them. So that has led to a slowdown in the number of cases we can release at one point in time. We're now starting to speed up that process. That's probably part of that explanation.
Some of the meat industry, Jerome, are a little concerned about supply heading into Christmas. There's been a couple of outbreaks at some of the abattoirs.
Yeah.
Are they in line for similar treatment as the supermarkets in terms of isolating staff and really narrowing down those risks?
Yeah, look, it's a good question, Blake. I think firstly, as I said yesterday, I think on the whole, the meat industry's done a fantastic job in the last 12 months in tightening all those COVID safe protocols, because for all the measures that they've introduced, the advanced vaccination, we gave their workforces earlier access to vaccination, so high vaccination levels have all meant we haven't yet seen outbreaks at any of our meat works in this outbreak. I'm concerned a little bit about COLAC. So for the first time, we've seen nine staff members at an abattoir all get COVID. They may have been outside of the workplace, so we're still working with the team down there. And really, I think we've now got 6 abattoirs in total where we're seeing at least one positive case. So the next week or two will be very interesting, because it'll tell us whether, as we've seen with aged care, whether the processes that they've adopted are strong enough to resist Delta coming in. So we accept with community transmission that there will be workers who pick it up in the community who bring it into the workforce. If we're not seeing that onward transmission the next couple of weeks, that'll give us greater confidence to then look at alternative ways of furloughing staff and simpler methods so they can manage their operations better. But it's all down to how this works in the next 2 weeks. If we're suddenly seeing lots of spread at those workplaces, that's going to give us real cause for concern. It'll give the industry cause for concern, and that will have an impact on their supply chains.
I believe the ED at Northern Health for the 27th of September has been listed as a Tier 1 exposure site.
Yep.
Given it's a high-risk area, is there any reason why that hasn't been uploaded onto the website?
I don't have that detail with me, so I'm happy to check it out this afternoon.
And do we know where the 3 individuals who passed away are from? Were they all in hospital, or what were they?
I believe they're all hospital, Mark. We'll share whatever data we can that Joe released this afternoon.
Sorry, do you know how many cases are connected to the outbreak at the Broadmeadows Immigration Detention Centre?
That's not on my radar. Happy to follow that up for you.
And do we know how many refugees have been vaccinated? Sorry.
No, but we can do that tomorrow.
Can I just close things off by, on your behalf and on behalf of all Victorians, thanking Michelle and Jackie who joined us today for the work that they do, and the tens of thousands of nurses just like them who across the public and indeed across the private system are there providing care and support to the most vulnerable in our community. We are all deeply grateful. Thank you so much. Thanks, guys.